COVID-19 has undoubtedly taken the world by surprise as scientists everywhere try to find ways to treat it. But is there a more unconventional method of treating COVID-19? This video will explore the question, is CBD or cannabidiol oil a practical way to treat symptoms of COVID-19? Cannabidiol, better known as CBD, is one of over 100 cannabinoids, the chemical compounds found in the marijuana plant called cannabis sativa. Unlike THC, the psychoactive cannabinoid in cannabis that causes a person to feel high, CBD does not contain mind-altering effects. CBD is an option for people looking for relief from pain or other symptoms from an injury or chronic illness. CBD oil has several uses, but the most common is for reducing pain, especially pain associated with diseases like multiple sclerosis or rheumatoid arthritis. Cannabinoids can impact certain neurotransmitters in the body that are responsible for pain and inflammation. CBD is also widely used to maintain certain body functions such as sleep and appetite. People with anxiety or depression have been shown to benefit from CBD oil. There are several ways to take CBD oil. You can use a CBD vaporizer, eat CBD candy, or infuse it into other foods, such as adding it to beverages like tea. However, the most common method for medical use is an oral formulation, which you can drop into your mouth, hold under your tongue, and swallow. CBD oil has been used to treat symptoms of conditions such as Parkinson's disease, Crohn's disease, cancers, epilepsy, and arthritis. But can it be useful when it comes to COVID-19? COVID-19 comes with various physical obstacles, mainly inflammation of the lungs. CBD has been used for a long time to treat inflammation of the skin by applying CBD oil or lotion to the area where the skin is affected. It turns out that CBD is also helpful for decreasing inflammation when it comes to COVID-19 as well. Along with clinical help from a doctor, CBD may be an efficient way of reducing symptoms that COVID-19 is shown to cause. So, how does CBD oil reduce pain and inflammation caused by COVID-19? High cannabidiol extracts have been reported to downregulate the enzymes ACE2 and TMPRSS2 in the body, which are oral and lung gateways which allow the COVID-19 virus to enter. By downregulating these enzymes, CBD oil can prevent COVID-19 from infecting the area. This means that CBD oil can potentially prevent a victim from being infected with the coronavirus in the first place. The diagram shows the damage that ACE2 can cause to the lungs. CBD also acts as a powerful antioxidant at various receptor sites such as PPARI5, HT1A, and transient receptor potential, or TRP. Antioxidants prevent enzymes from oxidizing, which keeps free radicals from forming. Free radicals are unstable atoms that can damage cells by causing inflammation. By acting as an antioxidant, CBD can prevent some of the inflammation caused by COVID-19, which can protect the lungs against permanent damage. The PPAR hormone, PPARY, is found in the alveoli in the lungs and limits pulmonary inflammation and promotes recovery following respiratory infections. However, PPARY can also secrete too many cytokines, which are a range of proteins involved in the immune system. Cytokine oversecretion can cause inflammation of the lung tissue. CBD is helpful because it can significantly counteract the onset of the overflow of cytokines, which as a result prevents the lungs from becoming inflamed. This brings us to the range of lung injuries that COVID-19 can cause. These complications include lung disease, pulmonary infiltrates, and alveolar capillary vasculitis. CBD oil can be very helpful in these situations. CBD acts as at the A2A receptors in the lungs, causing a reduction in damage to pulmonary function. Although cannabidiol can be discovered to be therapeutic when it comes to COVID-19, There is a lack of data on the effect it has on the virus when administered with other drugs. More testing needs to be done to ensure that it can be more widely distributed among COVID-19 patients. One testing strategy is to test CBD oil on COVID-19 patients at an early stage of the disease and to try to stop the cytokine overload. Another strategy is to study the effects of CBD in patients who have already recovered from COVID-19 and see how it works to prevent pulmonary fibrosis. Different plasma concentrations of CBD oil are needed to activate different pathways in the body. Though different dosages, ranging from less than 1 to 50 milligrams per day, have been used to treat symptoms of diseases such as Crohn's disease, HIV, and post-Ebola syndrome. A general recommendation for CBD usage for a COVID-19 patient who is 18 years or older is 30 milligrams per day with an upper limit of 50 milligrams per day.